The TLC2 program is a longitudinal experience where you're working with one preceptor out in your community, and your community can be anywhere in the state, really, rural or more urban, and so you're paired with them to work with and learn for 9 months.
In the future, I'd like to practice in a community-based setting, so I thought that the clerkships here in Tuscaloosa would provide the best opportunity for hands-on, more common real-life experiences as opposed to an academic institution.
Following a patient panel allows you to see the progression of diseases and also form relationships with your patients.
In an 8-week curriculum, you may not see that patient return, and you would never know whether the intervention helped them or not. They may come back 12 weeks later and you're no longer on that clerkship.
Rather than spending 8-week silos in the various specialties that we get exposed to, we spent 8 months being exposed to all of those specialties simultaneously and continuously. You get to see what following up with a patient feels like and learn those lessons that come with following up a patient. Learning what you did right or what you did wrong the first time you saw the patient.
I also really enjoyed working one-on-one with the attendings and having very few residents and interns and fellows kind of buffering your experience with the attendings, so you work really closely with them and get to know them.
Having the opportunity to work with physicians one-on-one in Tuscaloosa allows you to build a special relationship. One where you see a physician you worked with 2 or 3 months ago, they remember who you are.
So what it really does is gives you the opportunity to really get a relationship with them. They get to know you better, you get to know them better, and kind of the ins and outs of their clinic.
Having that close bond with the physicians here allows you to stay in touch over time, and they really invest in your future.
Over the course of the evaluation of longitudinal curriculum, it's very clear that students are well prepared from this model for any specialty that they choose. The record has shown that students are successful applicants in all sorts of specialties.
This longitudinal integrated curriculum, I think, helped me or better prepared me to make the decision of what type of doctor I want to be. And the way that it did that is that by seeing so many specialties over time and spending a little bit of time each week in each specialty rather than just focusing one specialty at a time, I was really able to objectively see what day of the week made me most happy, or what day of the week was I most excited about, what specialty was I most excited to go to that day. And that, for me, was surgery, and I think that doing this program made that an easier decision.
So I think the question is why isn't every medical school doing that? I mean, it's, because clearly it makes sense, it's intuitive that is a good way to teach someone clinical medicine.
Over the years, the longitudinal model has really been well studied, and it's now clearly known that, first of all, students do as well in the standardized measures of knowledge, the standardized test, coming out of a longitudinal model as they do out of the more traditional block-oriented model. But they also do better in certain domains. So for example, they typically have a higher volume of clinical experience and often have superior clinical skills because of that. They also don't lose the empathy. In fact, they have been shown to be more patient-centered, and for that patient-centeredness to be retained over long periods of time. And we also know that students that come out of the longitudinal model, they really understand more about managing patients. So they become very desirable residency applicants when it's time, as they're ending medical school, to be looking for a position in a residency program.